Now, South Africa has recorded over 5,000 new cases of COVID-19 in a fourth successive day. Another 97 people have died of COVID-19 related complications. So this takes the death toll to 56,929. Gauteng recording the highest number of new COVID-19 cases per day over the past week, with a daily average of 2,400 new cases. That followed by the Free State, which has recorded on average 436 new cases over the past 7 days. Active cases rising to 60,339. Let's get a breakdown of that now. Dr Ridhwaan Suliman, Senior Researcher at the CSIR. A very good evening to you, Doc. Thanks indeed. Great to see you once again. Let's unpack those numbers, starting with the average daily COVID-19 cases per week in South Africa. We seem to be having a sustained increase, up about 22%. Is that correct?
Good evening, Griselda. That's indeed correct. We are seeing a sustained increase in the number of new cases reported across the country. The current 7-day average stands at just over 4,630 new cases per day over the last week, and that figure is up 22% week on week. The sustained increase has continued. We've been seeing these increases for the last 5 weeks now.
And I mean, if we look at the comparison, Dr. Suliman, of the third wave versus the second and first waves, what we have noticed on these comparisons, what have we noticed on these comparisons between the three?
So if we look firstly at our case loading or case incidence rate nationally, it's up to 24% of the second wave's peak and up to 37% of the first wave's peak. Remember, the first wave's peak was lower than the second wave that we saw the peak in January. If we compare the rate of increase in the number of cases that we're reporting, currently the trajectory in this current wave seems to be following what we saw a year ago during the first wave. The rate of increase of cases currently is doubling about every 24 days, whereas at the same case loading during the second wave, it was doubling just under every 2 weeks, and during the first wave, doubling about every 3 weeks.
You have KwaZulu-Natal in that earlier clip indicating they're concerned. Their numbers are rising. They're heading towards that third wave. Gauteng long announced this. Let's look at the daily COVID-19 cases in terms of incidents per province. Gauteng, of course, leading that pack.
Indeed, Gauteng remains the province of most concern right now. There's quite a lot to unpack if you look at the different provinces. If we focus first on the 4 that are officially in their third waves, as mentioned, Gauteng's current 7-day average is about 2,400 new cases per day. So over 50% of the total number of cases reported across the country. And that case incidence this week is up 39% compared to last week. Northern Cape and Free State promisingly are showing signs of a decline. So while still at a very high case loading, both provinces have seen a decrease in the number of reported cases by between 8 to 10% this past week. So there's promising signs there. However, we do have to wait and see that and hope that this sustained trend does continue. Northwest continues on its increase, although the rate of increase has slowed there, up 3% week on week, and the current case loading is up to 55% of its second wave peak. Then the couple of other provinces that are starting to head into higher case incidence levels include Mpumalanga and Western Cape. Mpumalanga up 12% and Western Cape up 20% week on week. And then the remaining 3 provinces, including KwaZulu-Natal that you mentioned, are at a low case incidence rate, but all of them are rising quickly. KwaZulu-Natal up 28%, Eastern Cape up 32%, and Limpopo up almost 60% week on week.
But we also have tests that are also going up, I think, by 7% now, as you indicated much earlier in your constant reports on social media. That is up by 7%, is it?
That's correct, Griselda. So the number of tests that we have conducted this past week across the country is up to 38,000 per day, including both PCR and antigen-based tests, and that figure is up 7% week on week. I believe that the increase is largely due to more people presenting for testing, as more people unfortunately start to show symptoms or come in contact with a positive case. So the increasing trend in tests really does follow the infection curve, albeit counterintuitively.
A cause for concern, the average daily test positivity rates per week in the country, that also up by 12%. That's quite a worrying figure. I think it was just last week, if I'm not mistaken, where we'd just gone over about 10%. We're well over 12% at the moment.
Indeed, this is another metric that is of concern. It is following the same trend that we see in the number of infections, so it really does confirm the rise in infections that we have been seeing. So the test positivity rate this past week is up to 12.1%, and it has increased by over 1.5% compared to a week ago, where we had just surpassed that 10% level. So at a 12% test positivity rate, it means that we're now finding a positive case or positive test for every 8 tests conducted. It really is at a level that is of concern, and I think this will probably just rise now as we start to see more infections being reported and a higher demand for testing.
Before we wrap up there, Doc, I mean, hospitals up 16%, new COVID-19 hospital admissions per week in South Africa. That, of course, a cause for concern, particularly on the strain that will put on the healthcare sector.
Indeed. So not unexpectedly, the number of new admissions are on the increase nationally, following the trend that we saw in cases and test positivity rates. Just under 4,000 new hospital admissions last week across the country, and that's up 16% week on week. Gauteng new admissions account for almost 50% of the total admissions nationally, and in that province, the new admissions have increased by just over 30% week on week. Other provinces that are showing notable signs of increase in hospitalizations include Mpumalanga, up 13%, but also Limpopo and Eastern Cape. While the numbers are still low, the number of new admissions being reported are on the increase.
Doc, it's always a pleasure to have you. Thank you very much indeed for joining us, breaking down those numbers for us. Dr. Ridhwaan Suliman, Senior Researcher at the CSIR. Appreciate your time, as always, during this slot on a Sunday.